Dr. Jason Saunders here with HBOT USA. Today we're putting together a handful of videos answering your frequently asked questions regarding hyperbaric oxygen therapy, and we're going to break them up into individual videos just so that we can keep them organized. And so the first one is, what is hyperbaric oxygen? HBOT. Hyperbaric oxygen literally is hyper, increased, baric, pressure, oxygen. So inside of a chamber, typically either in a hospital or a clinical environment, or in some cases even at home with a soft chamber or home unit, you could create an increased pressurized environment. Why would you do that? Because right now we're living at 1 atmosphere is what we call it, which means there's about 15, we don't feel it, but there's about 15 psi being acted upon us right now. And as a result, and air is about 21% oxygen and 79% nitrogen. And so right now at 1 atmosphere and 21% oxygen, we're able to oxygenate our bodies to the level that we need to for normal function. Well, as it turns out, if you could put somebody into a hyperbaric, an increased pressurized environment, whether you're using air only or an oxygen concentrator or 100% oxygen, any version of increased pressure with air, you can increase the capacity that the body has to absorb that oxygen. And we use that for a lot of different things that we'll talk about in later videos. But basically, the agreed upon definition of hyperbaric oxygen therapy is any amount of pressure above 1 atmosphere, so anything from 1.1 atmospheres all the way through 6 atmospheres if you want to go that deep, with any variety of air only, oxygen concentrator, 100% oxygen, any version of increased pressure, increased oxygen, allowing the body to increase the oxygen that it's able to absorb for a therapeutic value, that's hyperbaric oxygen therapy.